On the Medical Watch tonight, a major surgery gets a reboot.
Medical reporter Dina Bair has more on a new approach to treating cancer of the esophagus.
It's a procedure similar to open heart surgery, but can be even more grueling. Patients with esophageal cancer often face a long hospitalization and require a feeding tube for weeks. In fact, one man turned down the traditional treatment and was willing to accept his fate until a robot intervened.
It's one of the biggest surgery there is.
That's how Dr. Samuel Kim describes a traditional esophagectomy.
People are staying in the hospital about 13 days after this kind of operation.
That's not the case with a robotic approach.
The way we are doing the operation, we're able to reduce that to stay no more than 2 to 3 days.
The option changed Rudy Bland's fate.
The Lord or somebody brought us here. Probably 8-10 years ago, I was diagnosed with Barrett's of the esophagus.
That meant routine upper GI and colonoscopy procedures every 3 years to monitor abnormal cells in the lining of his esophagus. The condition is associated with a higher risk for cancer.
Well, with COVID, that time span got changed, and when I was supposed to go in, they canceled.
By the time the 77-year-old did get in for his screening,
He gave me notification that he found some spots and they were going to check it out, and then later called and said, it's cancer.
the husband and father of 3 daughters was offered the traditional treatment.
They cut you open like they're going to have heart surgery, break your ribs. It's 3 weeks or more in the hospital, and then months of recovery with a feeding tube and a drain tube. And I said, no, I'm not going to do that.
And I thought, yeah, I do understand, but then we have to tell our daughters and the family, and they want you to do whatever it takes.
And I remember his face when I first told him about this, the sigh of a relief.
With his modified robotic procedure, Dr. Kim makes several small incisions in the belly to insert tiny instruments controlled by mechanical arms.
We're working underneath the breastbone without cutting any breastbone or making any chest incision.
Once the diseased part of the esophagus is removed, he stretches the upper portion of the stomach to construct a new passageway for food and liquids. The 2 parts are connected through an incision in the neck.
All right. Within typically 2 to 3 days after surgery, patient will be eating liquid food and then it will be going home.
No feeding tube required, but the stomach is altered.
So instead of having a 3 large meal, they'll be eating kind of small snack throughout the day, maybe about 7 to 8 times.
It's a big change. You got to concentrate on it.
1 month after his procedure,
They're talking like I'll be able to do all my normal activities within a month, 2 months, and I'm just overwhelmed.
most patients, including those who are elderly or frail, are candidates for the robotic approach unless their cancer has spread to other parts of the body. Back to you.